Stephanie Otto Batazzo's toddler was feverish for days before she was referred to a pediatrician. But despite testing negative for COVID, her only option was a virtual appointment.
I said, yeah, I would love her to see her because this is getting worse, not getting better. And he said, no, we're not taking any kids in person.
She was advised to go to her local emergency room, where she spent 8 hours.
You overwhelming the doctors because they're emergency doctors, and this is not an emergency, and you're overwhelming the kids with the long waits.
Complaints like these have prompted the College of Physicians and Surgeons in both Ontario and Manitoba to ask doctors to resume in-person care. The colleges say high vaccination rates and access to PPE mean in-person visits are safe.
We've heard from our emergency colleagues that patients are presenting later because they haven't had the necessary in-person assessment.
Manitoba's college says after November 1st, registered physicians who aren't complying with in-person visits could face disciplinary action. This pediatrician says doctors are having to balance safety concerns in their offices, especially with unvaccinated patients.
The other part of it is then higher risk children. So if they're exposed to someone with COVID and have COVID symptoms, those are children that we might not want to bring into our office.
And you're using your walker?
Oh, yes.
Family doctor Iris Gorfinkel sees patients in person 3 days a week, but says virtual care still helps.
If they're just here for, say, a prescription renewal or a quick referral, something that we know they need, then, that's easily done by virtual care.
While virtual care has a place, say health authorities, it shouldn't replace in-person visits. Tashana Reed, CBC News, Toronto.